Great. Thank you, Dr. Shariki and Dr. Huang, for that terrific keynote. What a great way to kick off our day today. Our next panel is called Making an Impact That Lasts, Ensuring Local Relevance and Sustainability of PSE Interventions. This panel will be moderated by Dr. Erin Hager, who is an associate professor at the Johns Hopkins Bloomberg School of Public Health and the Department of Population, Family, and Reproductive Health. Dr. Hager, I'll turn things over to you to introduce your panel.
Thank you, Dan. So welcome to our first day 2 panel discussion. Over the next 40 minutes, we're going to hear from 3 remarkable researchers and practitioners who will share their experiences regarding local relevance and sustainability of PSE interventions. So since our session focuses primarily on interventions involving healthy eating interventions, I will briefly introduce each of our speakers and then share their favorite mode of physical activity to try to keep it a little bit light as we get started. So as you just heard, my name is Erin Hager, and I have the honor of moderating this session. And I personally enjoy hiking in the state park near my house to get my physical activity in. Our 3 panelists include Dr. Deanna Hoelscher, who will speak first, and she is the Regional Dean of the UT Health Houston School of Public Health in Austin, Texas. And in her free time, she enjoys walking her 2 big dogs and trying to train them. Then we'll hear from Dr. Jennifer Falbe. She is an associate professor of nutrition and human development in the Department of Human Ecology at UC Davis, and she enjoys hiking with her dog as well. And then finally, we'll hear from Dr. Amy Meinen, who is a registered dietitian and public health practitioner supporting research that addresses systems change at the University of Wisconsin-Madison School of Human Ecology, and also through healthTIDE, which we'll hear a little bit more about today, which is a statewide network that supports healthier communities. And she enjoys pickleball and also hiking in national parks. So we have a whole team of folks who like getting outdoors. So full speaker bios are available online, and we will have a moderated discussion following the 3 presentations. So feel free to add questions using the Q&A function if you think of them throughout the talks. And with that, I am going to turn it over to Dr. Hoelscher to get started.
Thank you, Dr. Hager, and thank you all for inviting me here today to talk about how we did tailoring and Fidelity for Texas Cord. I'm really excited to be here and looking forward to the discussion. So next slide, please. Just a quick disclosure to let you know that royalties from Catch go to our university. Next slide. I'm going to be talking about our Texas Cord project, and I'd like to acknowledge the many investigators who worked on this project along with myself. And one of them includes Dr. Wang, who was just on the, just gave the keynote. But we also were funded by CDC, and we had other support for this work, as well as a lot of community partners who you see represented there. Next slide. So before I begin, I'd like to just talk a little bit about our study design and the components of Texas Cord. So with Cord, we looked at both primary prevention, and so we operationalized this as interventions that went to the whole community, regardless of child's body size, but just general healthy living. And so with that, we had elementary school programs, which were Catch. We did programs in the child care centers. Most of those were Head Start, and those were Catch Early Childhood. We also did some interventions for primary care for providers and physicians. And so there we did the Next Steps program. We also did some policy training. With the primary healthcare, at that point, if kids had a BMI that put them in overweight or obesity category, they were referred to our secondary prevention program. And so that included the MEND program, as well as support from community health workers. And these were conducted in the YMCA. So they did the MEND program as well as some physical activity. So next slide. So I think it's important to know about the different sections of Texas Cord so you can see how we adapted them. So just a little bit about what we did in terms of tailoring for Texas Cord. So the first thing we needed to do was determine what the program components were. So with dissemination, you need a package. So it needs to be kind of self-contained. And so with that, we put together our next steps package, our catch package, a catch elementary package, and then our catch early childhood package. And along with that, we needed trainings that kind of taught the community partners how to implement these programs. So the trainings were quite different for the elementary school teachers. They were in person, for example. For next steps, the physicians and primary care providers, they tended to be webinars. And a lot of times they were during lunch. So they were relatively short. We also did a lot of development of materials for CORD based on our prior implementation of these programs. So for example, one of the things we had developed is the catch coordination kit. And what this does is it looks across the school year. It's kind of a system level approach to getting a program implemented. And so there's 2 activities for the fall and 2 for the spring. And what it does is it breaks the school down by different components. So food service versus PE versus the classroom curriculum. And so there's a theme to each of those sessions. And then everyone has kind of a part of that theme that they carry out. So to do that, you kind of coordinate across the whole school. So what we did was we adapted the catch coordination kit, and you can kind of see it in the middle there. It's kind of small on the screen, but we adapted it to early care and education. So we developed a catch coordination kit there. With next steps at the time we did it was only available in English. Well, in Texas, in our population, we really needed a Spanish translation. So we did the translation of next steps as part of our tailoring. The other thing we did was we used our Catch Kids Club for MEND activities. So we adapted, Catch Kids Club is our after-school program, and we adapted those programs. So the activities, So the activities had to be adapted for kids who were deconditioned, and we also had to include some safety protocols in there since many of the kids were not used to as much activity as they were receiving in the program. And then finally at the end, to put all these components together, we needed to have a coordinating organization. For CORD, it was the grant. So we served as the coordinating organization. Once the grant ends, though, you need to transfer it to another organization, and that's where Catch Global Foundation comes in. So the next slide, I liked that Terry referred to you need to measure for implementation. So when we did CORD in the elementary schools, we gave out surveys to teachers who were doing implementation. So each school had several teachers who took this survey. And so on the survey, there are measures of implementation, and I'll show you those in the next slide. But if you look at this, you can see, just to orient you, the first set of bars is for catch year 1, and the next is catch year 2. The second set of bars is overall year 1 and overall year 2. So when we say catch at the bottom, we had 2 sets of questions in the questionnaire. So some were, how did you implement catch in the school? The others were, how did you implement health education? So those were more general questions. So then we categorize them by low implementation, medium, or high implementation. So what you can see is for the first set of bars there, the blue are the intervention schools, and then the red is the comparison schools. So you can see after 1 year of implementation, our intervention schools were all in the high implementation. In year 2, they kind of backslid a little bit in terms of catch. If you go to overall year 1, you can see that last bar is all blue. So they were implementing, the intervention schools were all in the high implementation range. And then overall year 2, again, there was some backsliding, not as much as we had seen with the catch program. Next slide. So some of the factors associated with better implementation. So these are some of the factors that we measured, and this was developed from our Catch Travis County demonstration project. But if you look at this, one of the things you can see is with Fidelity, you have to operationalize it. And so in our catch work, these were activities that we saw as operationalizing implementation of the program. So for example, when you look at environment, one of the things, the third bullet is weekday themed events. So what they had was a weekday themed event could be a Wellness Wednesday where you might do a physical activity, or it could be a Fresh Fruit Friday where each child brought a fresh fruit and ate it during the snack period. So these became ingrained within the school structure, and they enabled the catch language to kind of, and catch intervention to kind of, it reminded them of it on a weekly basis. Next slide. So a little bit about our lessons learned. For primary prevention for the catch programs, we found that the early care and education programs were easier to implement and more likely to show effects compared to elementary schools. And so there's a couple of reasons. One, there were no academic testing. There was no academic testing pressure, so it was easier to get into them. The parents tended to be more receptive to health messages at that age group. The implementation status, though, we found was very important. And so there really is a need to measure implementation, as Terry referred to. For secondary prevention, what we found was the dose was related to outcomes. And so our lessons learned is programs need to maximize dose by making the intervention components flexible and easily accessible. So one of our intervention sites, for example, was not on a bus route. So it was difficult to get families there sometimes. One family took a taxi to come. You also need to keep in mind that families have many competing priorities and low resources, so you have to schedule around that. So for example, tutoring or church programs or things like that, and other kid activities as well. Coordination of the Texas Cord components was difficult, so there wasn't one organization or individual there to fill that once we left. So that was part of the impetus for creating the 501c3 organization. And then we found that the community level programs and the primary and secondary prevention approaches that we used was more successful with children with moderate levels of obesity. So you need more intensive programs later on. Next slide. So I wanted to talk just briefly about limitations to scaling. So this is something that we have found through CORD and other projects that we've done. So number one is funding. So a lot of funding that you get from foundations, sometimes they're reluctant to support universities. And then few of them support for-profits either. So they really want nonprofits that indirect costs for the university really kind of throws them off. In addition to scaling, most universities don't have a baseline budget for infrastructure or innovation. So how do you do marketing? How do you do technology? We took Catch from a paper-based version, hard copy version, to online. So you need to have money for that transformation. For sustainability in universities, there's a difficulty in developing succession and bench strength for the program. So a lot of times when we did these programs, it was, and even if we got foundation grants, it was categorized by the university as service rather than research per se. I think that's a little bit better now with the implementation science, but it can be difficult to encourage young faculty to jump on board something that doesn't have research output. The research grant cycles also don't extend to program maintenance. And then finally, the focus, the university mandate is research and teaching. So there's a lot of focus on bibliographic output and grant output and not necessarily community impact. So some of that is changing, but that is something to be aware of. We also know as academics, a lot of us are not trained for dissemination or marketing. So a lot of times we don't want to say a program is wonderful. We point out all the limitations, which we know well. And then finally, there's an inability to scale nationally and globally because you really need those channels. And to establish those takes time. If you could click the next again. And basically what I wanted to show with that diagram is you would need to know what works, what people want, and then figure out a funding mechanism for that. And that's when you can get impact and you reach health nirvana. Next slide, I think, is just my contact information. So thank you very much, and I'll see you in a minute.
It's a fantastic presentation, Dr. Hoelscher. We really appreciate that. And now we're going to move on to hear from Dr. Jennifer Falbe.
Hi, everyone. Thanks so much for having me. So I'm going to be talking about a case study of two different policies, a sugar-sweetened beverage excise tax and a healthy checkout policy in the city of Berkeley, California. Next slide. So the sugar-sweetened beverage tax was really a whole of community intervention, and I'll go into explaining why that is. And I'm also going to focus on the role of community in both the adoption and the implementation of the policy. Next slide. This is the current landscape of sugar-sweetened beverage taxes, just to provide some context. And Berkeley was the first city in the nation to implement an excise tax on sugar-sweetened beverages, which are paid by manufacturers. Next slide. These pictures here show the broad community support and coalition that supported the adoption of the tax. And it consisted of parents, teachers, young people, community-based organizations focused on health equity, and the tax passed with a supermajority of the vote. Next slide. And from quantitative research that I've done and others have done, we found that the taxes increased the shelf price of sugar-sweetened beverages, decreased consumption and sales, and reduced child adiposity outcomes. And then through qualitative research, we have found that the tax has increased funding for nutrition and health equity programs. Next slide. This slide right here really illustrates how the tax became a whole of community intervention and the role the community also played in the implementation of the policy. So at the very top here is the ordinance that established the tax. It also established a community advisory commission with expertise in multiple areas to advise on how the tax revenues should be spent. And this commission resulted in funding the public schools cooking and gardening program, which makes healthy food and nutrition education available to all children. And it also funded CBOs, community-based organizations focused on health equity, like Healthy Black Families, a veggie prescription program, tap water promotion. And they funded youth CBOs to work on the issue of healthy checkouts. So through the CBO funding and also through recommendations the commission made directly to city council members, this led to the expansion of policy change within the city. So Berkeley then adopted a healthy default beverage law for children restaurant meals, a ban on city government sales and procurement of sugar-sweetened beverages, and then third, a healthy checkout ordinance, and in fact, the world's first healthy checkout ordinance. And you know, the commission did this in part, you know, because it's comprised of community members by mandate. By mandate in the law, they also had to focus on either sugar-sweetened beverages or health outcomes related to sugar-sweetened beverages. And this commission took a really intentional approach of funding programs to work on policy systems and environmental changes within the city. So the tax itself reached a lot of people through its effects on the retail environment, but then also through these downstream effects on funding community organizations and funding work that leads to further policy change. So next slide. So how did we learn all of this? Well, we conducted an implementation evaluation. And this evaluation, our objective was to characterize determinants of implementation, the implementation process, and lessons learned for translating a policy into the intended health effects. So this was a qualitative study using 48 key informant interviews with folks from city staff all the way to retailers and sugar-sweetened beverage distributors. And we also reviewed documents like the ordinance itself, industry letters, and this work was guided by an implementation science framework called CIFR. Next slide. So to summarize what I kind of already showed you on that slide 2 slides ago about the Community Advisory Commission, some key findings from our implementation evaluation are that this advisory commission was really key in the sustainability of the sugar-sweetened beverage tax and in the expansion of that policy into other nutrition policies. And some key mechanisms here were that the Community Advisory Commission was able to fund community priorities because they were deeply embedded and knowledgeable about what the community wanted. And this was important for sustaining public support for the sugar-sweetened beverage tax policy. And the other key mechanism here is that the Advisory Commission was very intentional about funding organizations to work on policy systems and environmental changes. And this led to sustainable changes in food environments and health behaviors in the city of Berkeley, in part by expanding to other policies. Next slide. So now I'm going to shift gears and talk about the world's first healthy checkout policy, which was implemented in Berkeley in 2021 as a result, in part, of the soda tax and the commission. So next slide. To tell you more about the ordinance, it applies to all large food stores within the city, defined as over 2,500 square feet, selling at least 25 linear feet of food. And it applies to all foods in all checkouts, unlike a lot of voluntary healthy checkout programs, which might be, one healthy checkout in an entire store. And the ordinance has nutrition standards where only unsweetened beverages and gum and mint with no added sugar are allowed at checkout, and only foods that meet certain standards. The foods cannot have more than 5 grams of added sugar or more than 200 milligrams of sodium per serving. And they have to fall in certain healthier food categories like fruits, vegetables, nuts, seeds, legumes, yogurt, cheese, and whole grains. Next slide. And so I am leading an evaluation of this policy, and I'm going to just focus on 2 objectives. One is to examine the adoption and implementation of the Healthy Checkout Ordinance and to assess the impact of the ordinance on store food environments. Next slide. We so far been studying the adoption of the policy using similar methods to that implementation evaluation I showed you. It's qualitative. We're using interview guides guided by Kingdom's multiple streams framework and interviewing key informants in the city and also reviewing documents. Next slide. And a key finding here is, again, that community played a key role in adoption and implementation of the policy. So this youth CBO on the left, Bay Area Community Resources, which you can see was funded through the Soda Tax Commission to focus on healthy checkouts. And they used citizen science to garner community and policymaker support and show there was a need for a healthy checkout policy. And then they were also funded through the Soda Tax Commission's recommendations to actually do the initial outreach and technical assistance to stores to implement the policy once it went into effect. Next slide. And so our second aim or second objective here is to examine the effects of this ordinance on store food environments. So we're using Berkeley as our intervention city and 3 Northern California cities as our comparisons, and we're doing longitudinal observations of products at checkout. Next slide. I'm not going to go over this too much, but I'll just say we're using a photo-based tool that's highly reliable to take pictures of every single product at up to 3 checkouts per store. Next slide. And we took pictures of the products, we linked it with nutritional information, and these are our 1-year results on how the policy is being implemented by stores. So the left is Berkeley, the right, the gray bars on the right is the comparison cities. And we see that from before to 1 year after the policy was implemented, there was a 63% relative increase in the percent of all products at checkout that were compliant with the policy, with very high compliance post-policy in Berkeley of 83%. That's really high compared to other food policy implementation studies like healthy beverage default laws. Next slide. And this really, so this slide right here focuses on the 1-year results. If we restrict our analysis to only foods and beverages placed at checkout, we see 125% increase in compliance on the left side. And this was accounted for by a big increase in unsweetened beverages and healthy foods, and a big decrease on the right side in sugar-sweetened beverages, candy, and other sweets at checkout. Next slide. These are just some before and after pictures. You can see the candy on the left at the supermarket was replaced with sparkling water and dog treats on the right side. Next slide. And this is a drugstore where sweets and salty snacks on the left were replaced with bowls of fruit and rapid tests on the right. Next slide. And so just to wrap up with some key reflections, a well-designed sugar-sweetened beverage tax policy can be a whole of community intervention, especially if it has some mechanism like a community advisory board to fund community priorities, which can further lead to policy sustainability. It can also catalyze other food policies like the Healthy Checkout Ordinance, which can help sustain behavior change. And the community in these 2 case studies played a really key role in policy adoption and implementation, which may also have played a role in the sustainability of these policies. So for the SSB tax, the Community Advisory Commission was key, and for the Healthy Checkout policy, the Youth CBO was really key. And then lastly, it's really important to use qualitative and quantitative methods for understanding the big picture of policy adoption, impact, implementation, and sustainability. And then my last slide is just some acknowledgements. Thanks, everyone.
Yes, thank you, Dr. Falbe. That was also a great presentation, and I'm so excited for the wrap up with Amy Meinen. So we're going to hand it over to her to present our final presentation.
Thanks, Dr. Hager, and thanks for having me. Such great presentations, Dr. Hoelscher and Dr. Falbe. I was taking a massive amount of notes during those. Hi, everyone. My name is Amy, and I'm going to be talking today about the healthTIDE network. So I would say I'm not going to present too much on the research that's been done in some of these cases, but if you're interested, I'm happy to talk after. Next slide. So healthTIDE began in 2012. Really around the concept of building a multi-sector partnerships across our state, really thinking about all the different settings that we wanted to be working in, schools, early childhood, the food system, the built environment, and how to really align resources, funding, partnerships to address the needs of our communities across the state. So the healthTIDE network was started with that in mind. And I just want to say, over the course of the last 2 days, there's been so much that I feel like resonates and aligns with this concept. Next slide. How healthTIDE works is it works really at the base to connect and convene people and organizations to one another, really fostering those multi-sector, cross-sector partnerships. We do a lot of convening from local communities to state agencies and organizations from around the state. That convening really brings people together who have mutually aligned interests, mutually aligned goals. We look for energy, which I'll speak to in a minute, some of the areas of work that are happening statewide and within our communities across the state of Wisconsin. There's a lot of opportunities that present themselves to think about healthy communities and what we can do to influence policy systems, environmental change. So the network is constantly looking for areas where we can catalyze momentum to achieve these types of changes. Next slide. healthTIDE, as it stands, has over 3,000 people and organizations across the state that are involved in this work to create healthier communities through PSE change. We work, again, in these 4 areas of collective action, connecting people and partners from around the state, catalyzing where we know there's energy and momentum, and spend a lot of time convening and bringing people together who have mutually aligned goals. Next slide. I want to just give a few concrete examples of how the network has worked over the last 12 plus years. And I want to start with telling a little bit of a story around some of the work that's happened in our early care and education system here in Wisconsin. We've been able to work to really connect public health practitioners and early childhood providers and organizations and associations to one another. It took quite a bit of time to learn each other's language. I kind of laugh now that we have so many early childhood partners that know what policy systems environmental change means. They know what the word PSE means. They understand what it means to change systems and what that can look like. This sort of shared understanding, shared learning has taken many years of very intentional relationship building and, again, spending time really understanding systems and the levers within each of these systems. So within the early care and education system here in Wisconsin, we've been able to, through a series of partnerships and research and pilots and efforts within our child care centers, we've been able to add wellness criteria to our Wisconsin Young Star, which is a quality rating improvement system for child care centers, both what we call group and family child care centers. This work was years in the making. It took multiple agencies, state agencies that don't typically work together, coming together to create resources for early childhood providers. It took connecting with university researchers to help us understand the best strategies and understanding the policies and implications of practices that were being put in place. That research and those validated tools were critical to really working with our State Department of Children and Families to get these wellness criteria in Young Star, as well as maintaining it for so many years. So that's one example of how a network and really building these multi-sector partnerships can make a difference. Another example is a 5-year project involving multiple community-based organizations, our State Restaurant Association, and a number of nonprofit organizations that work together to create healthier kids' meals throughout Wisconsin. One of the best and most impactful things that we're proud of here is that we were able to work with a multi-unit fast casual restaurant that's Wisconsin-based, but headquartered here, but has reach across the U.S. They were able to, through a series of conversations and focus groups with parents, they changed their default beverage from soda to milk. Next slide. A couple of other quick examples I want to point out. In this last year, our Wisconsin legislature commissioned a childhood obesity task force, and we were able to utilize a number of network partners to help educate legislators on the importance of healthy environments and what those look like for kids. I'm happy to report that we were able to achieve one piece of legislation this last session that did pass, that does fund a really important project related to nutrition incentives, related to farmers markets and double up bucks. In terms of working more effectively now and in the future, we've had lots of lessons learned in building the statewide network over the period of time that it's been in place. We started out very strongly implementing collective impact principles, and we've slowly over time added what I would say community engagement and community organizing principles to this work. And especially after all network assessment in 2019 related to equity, we've really been focused the last several years on this idea of communities leading, shifting power to them. And a prime example of this is some work that we've been doing with a statewide partnership called Healthy Early. Healthy Early has been around since 2007. It's a partnership that, as I mentioned, has worked so hard to achieve a lot of outcomes within our early childhood settings here in Wisconsin. That group was predominantly led by state agencies, organizations, and associations with not much input from community. So we flipped the structure. And over the last couple of years, through strong relational building, we've identified a number of Healthy Early leaders from around our state who are now in charge of setting statewide priorities and making the decisions. And so how it works now is leaders decide what's important. They set the priorities, and the partners and organizations are still at the table. And the plan is for them to align their resources, their research, their energy towards what those priorities are. So we are working, again, to center community voice in this work. I just want to say, based on Dr. Wong's presentation, we are in the process of designing a pilot right now related to design thinking with our local and tribal health departments. We've spent a lot of time over the last 4 years training our local and tribal health departments on systems change using a course from the University of Minnesota. I want to highlight the importance of showing up and listening and aligning these resources and funding. This idea of a network really grounds itself in listening to what our communities are saying they need, our community members, what kinds of environments that they want. And it's our job to connect them to resources, funding, technical assistance, whatever it's going to take to facilitate those changes getting in motion. 2 examples of this are some work that we're doing with the Great Lakes Intertribal Food Coalition and some community conversations. Next slide. The Great Lakes Intertribal Food Coalition is something I would say over my course of my 20 years is something I'm most proud of. This is a historic partnership across 11 federally recognized tribes here in Wisconsin to transform and revitalize an intertribal food system that once existed in pre-colonial times. It's built on supply and demand principles and has focused heavily on rethinking how food is produced and putting the priority to purchasing food from tribal producers. This effort has, I think, highlighted the importance of showing up, listening, and it's been our job within the healthTIDE network to support what's needed. We've assisted with aligning resources, finding funding, helping with grant writing, and aligning the research to support the vision of the efforts of the tribes. The tribes have effectively implemented a tribal elder food box program over the course of the last few years. And so we can talk more about that if you're interested, but just want to highlight the importance of partnership building and how it can create systems change within a food system. Next slide. To highlight the importance of showing up and listening, we've spent the last 3 years supporting community conversations. These are led by community members. So again, researchers and public health practitioners are not the ones leading these conversations. These are individuals who have been trained to have these conversations within their own communities. We've been able to have them with 2 Black communities in our state, 5 Indigenous communities, and 5 Latino communities across Wisconsin. Highlighting a couple quick things here, the importance of compensating these community leaders for their time and involvement, using this opportunity to pay them just like we would consultants. And lastly, really critical is data given back to these communities. There's often this extraction that happens with research. And so there's been this real intentionality for community members to be along with the entire process. In the case of the Latino community conversation, we had a number of community members take the human subjects training and go through the IRB process with us. this is valuable for them to learn those skills so they can carry these things forward and continue to make impacts in their own communities. What we're excited about is that these community conversation findings are currently right now being used to inform statewide needs assessment processes that are underway around SNAP Ed in our state, as well as our maternal and child health Title V block grant planning. So again, here to highlight the use of a statewide network to facilitate policy systems and environmental change while centering community voices in this work. Thank you so much. I think we're at time.
Yes, we are. Thank you for the wonderful
Yes.
presentation. And now we're going to pivot to our discussion and Q&A. And okay, here we all are. So we're going to use first names just to keep it, again, casual as we have a discussion about the wonderful presentations we just heard. I want to start with a question for all of you. So you each spoke about sustainability of your programs or adapting evidence-based programs to a local context. And it made me think about the saying, begin with the end in mind. And so what advice would you have for folks who are beginning a new pilot program or starting out with a new idea to really think about the end game? And so thinking forward to future sustainability of their programs moving forward. Anyone can go.
I can
Yeah.
start. I think if you want sustainability, you need to have very concrete. I had talked about having a package or very concrete so they know what to do. So I think it's good to have protocols and procedures and things like that. I think one thing for us that's important is if you think you're going to be, you want sustainability in a certain community, like the Hispanic Latino community, you really need to do some of that cultural adaptation from the get-go rather than wait and just do a surface level adaptation. So those are just two that I would consider.
Great. Amy or Jennifer?
I'll just go ahead.
Yeah. No, you go first, Amy.
I would just say something that has been a newer strategy for us is using systems mapping, really thinking about the leverage points. It gets us thinking about the long game. Some of these systems levers might be policy changes. They're going to be multi-year efforts to achieve, but there's clearly benchmarks along the way. So really mapping out what those are and really thinking about short, medium, and long-term goals. We utilize a lot of systems mapping, and I would say logic modeling within the systems mapping, if that makes sense.
It does. That's great advice. Thank you, Amy. Jennifer?
And for policies, I would say focusing on how the policy is written. The policy language itself is really important. So for the SSB tax, making sure that it specifies a community advisory commission and that if it can, earmark money for that purpose. And then for the healthy checkout policy, really thinking ahead of time when you're writing the policy on implementation and enforcement. Is there an agency who's already inspecting stores that can incorporate this into their workflow? And that should be incorporated into the policy as early as possible.
That's great advice. Wonderful. Thank you all. And so, Deanna, I really appreciated your wrap up of your presentation where you talked about all the barriers you've experienced. I think a lot of us who do this work heard you, and definitely it was really a great summary. But Jennifer and Amy, you didn't talk a whole lot about barriers you've experienced. Could you just note what sorts of barriers you've seen in sustaining or adapting your programs and policies?
So I'll go first. I think so. Perhaps a barrier that the city of Berkeley did not deal as much with for either the tax or the healthy checkout ordinance is industry opposition. And I will say they did deal with industry opposition for the tax during the campaign, but did not necessarily face as much like post policy adoption repeal campaigns like other cities have faced. And I don't know if that's because, Berkeley's the first to a lot of these policies. So sometimes they fly under the radar. It's kind of a wait and see approach. But I think that is definitely a barrier that other communities especially need to grapple with and anticipate. And it's always great for those communities to reach out to other cities that have, implemented policies like this to try to get a sense of what to anticipate. And Berkeley just also has such a strong interest in public health and such a strong community mandate that even with industry opposition, a lot of the city council members don't, they're willing to really stand up to the industry.
Great, thank you. And Amy, do you have any comments?
I would say, in terms of communities doing PSE change work, there's a lot of common barriers and challenges we hear. There's a lot of high staff turnover within local and tribal health departments or county extension. These are a lot of the change agents that are often involved in starting or facilitating or convening some of the initial phases of PSE work. So that's something that's a constant. I would say also funding, convincing funders to stay in the long game. That these types of PSE changes take more than a year or two, to offer that planning grant followed by an implementation phase. Those types of things are going to continue to be barriers. Funding is like the number one thing that we're constantly hearing from our community partners across the state.
Yeah, no, that resonates with the first talk we heard from Terry as well. And so kind of to this topic of barriers, back to Deanna, is there anything out there that's making you hopeful that we can kind of overcome any of these things? I know you mentioned a few things in your talk, but is there a change of tide that you see happening or anything that's making you hopeful for the future?
I think a few things. One is I think implementation science is really being pushed forward. So I think people are appreciating the value of looking at how interventions fit and sustainability and things like that. And that wasn't always the case. And so there's a lot of training, there's new nomenclature, new language, so I think that that's helpful. I think some universities, especially schools of public health, are starting to look now at impact and other assessments in the tenure and promotion. It's still not quite as robust as we might want, but I think there is some conversation about that. And then I think the nonprofit world, I think more groups are realizing that that might be a venue to extending their programs.
Yeah, no, that's those are definitely things that make us all hopeful. And it's interesting you just mentioned nonprofits. I was going to switch to the chat, but I do have one last question about this nonprofit concept. I found it really intriguing that both Amy and Deanna kind of have a foot in these nonprofit worlds and academics. And so as a whole academic person, I'd love to hear more about what that's like to balance those two worlds and the pros and cons of living these two different worlds in your work.
Amy, why don't you start?
I think it's a beautiful thing on a couple of fronts. One, when you start talking about policy change, the P is policy, right? And that often involves formal legislative policy, which can be complicated in an academic or research or university environment. So I think having that nonprofit arm to this work is critical because that is where, when there's moments of key advocacy or there's things that need to get organized in terms of policymaker education, or even we talk about direct lobbying versus education, those are moments where a nonprofit entity is critical. I can think of many more, including funding and really thinking about funding for community can be difficult in terms of getting community members compensated. I don't know if this is the case across other universities, but it's, community members don't want to be paid 8 weeks after they were involved in designing an intervention or whatever it might be that you're asking for their input or their involvement. So we're finding that the nonprofit side of things is very nimble and we're able to more effectively engage with community members.
Yeah, and I would add to nimble was kind of one of my words I was going to use because they can do things we can't. They can move faster. We were doing trainings and trying to do it through the university, and the payments just got really crazy. And it was a while before we got the money. Anyway, nonprofits can do a much better job of that. I think where we're helpful to nonprofits are kind of telling them what's the next thing you need to look for, or, you know, if dietary advice changes, we can provide that or say, this is on, you know, this is coming up. Because I think one of the things that we don't talk a lot about in sustainability, especially with nutrition, it's for other fields as well, but it's always changing. So you really have to have that iteration. And I know Terry had kind of mentioned that too, but that iteration and then that testing again. And so the academics are good at that. And then they can give it to a nonprofit to do what they do best in terms of marketing and getting it out and supporting it.
That's great. That's wonderful information. So we just have a few minutes left, and there are a number of specific questions for Jennifer in the chat, actually, about the taxes and how they were they were set up. So the first question is, did the ban on city government sales and procurement of SSBs impact parks and recreation sites or other built environment investments? So were there unintended consequences of the way the law was set up?
That's a great question. Not that I'm aware of, but we haven't done a formal evaluation of that particular policy.
Yeah, I know it's definitely something that we all think about, these unintended consequences. And then do you know if there were communities that were more likely to be paying the tax? So were there disparate impacts on the tax as it was implemented?
Not that I am aware of. It applies to a pretty broad swath of beverages. And again, they are paid by the manufacturer or the distributor. That it's not a direct consumer tax, but it, you know, if they choose to, they can pass it on to retailers. Retailers can pass it on to consumers. But one thing we did see is that it was not being treated as a quote unquote grocery tax, which is sort of the industry anti-tax campaign message. What we found was that retailers were applying it only to beverages and pretty much to sugar-sweetened beverages, with an exception of maybe some confusion initially around like diet versus sugar-sweetened.
Very interesting. And then lastly, the healthy checkout ordinance I thought was really novel and something I hadn't heard a lot about. Is there any momentum to adapting that type of a policy in other jurisdictions that you're aware of?
Yeah, actually, the United Kingdom has adopted a whole country, or whole country policy that even goes beyond the healthy checkout policy to additionally restrict, high saturated fat, high added sugar, high sodium products from many key places within retailers. So front of store displays, end caps, checkout. So I'm really curious to see how the evaluations come out from that. Paris, California became the second city in the nation to adopt a healthy checkout ordinance recently. And there's some other active campaigns that are working on this. So yeah, I think there's some momentum. There might also be some opportunities to incorporate this type of policy or this type of approach at the federal level potentially. So I think there's a lot of interest and momentum here on not actively promoting unhealthy products and key places, right, where impulse purchasing might be common. And also, just to go back to the previous question you asked me, some of my colleagues have done some analyses to see, overall, if we look at soda tax policies as a whole package, which communities do they impact the most? And it actually seems like the effects are progressive. If we account for the community investments and the investments in programs, lower income communities are more likely to benefit from these excise taxes.
Wonderful. That's a great message to end on. So we're actually right at time. So thank you all so much. This was a really intriguing panel and your presentations were fantastic and I appreciate your discussion. So I think we turn it over to Dan now.